thank you to give me the opportunity to present you a work we made about the results of 82 knees at 2 years minimum follow-up of single bundle reconstruction of the ACL with the TELOS technique. What's the hypothesis? We wanted to show that the TELOS technique, too fast, provides short-term results as good as classic technique, as BTB or hamstring techniques. So we made a continuous prospective and multi-center study of 82 patients operated on in 2007. We include unilateral rupture with semi-acute of 2 to 12 months surgery. We exclude re-rupture and partial rupture. So the series, we had 82 patients, the sex ratio was 58 male for 24 female. The average was 29 years old. We had 45 right knees and 37 left. The follow-up was more than 2 years. What is interesting is to see that more than 50% of the patients were more than competitors and high-level sports players. And most of the patients practice pivot contact sports. In this series we had 43 cases of meniscal injuries. We resect several of them, and we didn't touch for 20 of them. In the IKDC subjective score, we see that we passed from 68 points before the surgery to more of 90 points after the surgery. The several failure and concerned algal dystrophy and one case of saphenous neuroma. The LYSHOLM score is significantly 2. We passed to 74 points to 94 points after the surgery. The IKDC objective score is significantly 2, with more than 70% patients after surgery include themselves to A or B category. And the most important thing for me is the patient satisfaction, what is feeling. And we see that after 2 years, we had 9 to 10 patients very satisfied, and more than 85% of patients will accept to make again the surgery. More than 70% of patients recover the level of sport they made before. And we see that the TELOS score is sensibly the same after the surgery. We measure the objective stability, and 84% of patients was known pivot shift after the surgery. We made 2 exams with the TELOS and shown that more than 90% had less than 5 millimeters laxity comparatively with a healthy knee. And we made the same with the GNRB, showing that more than 90% of the patient had less than 5 millimeters too after the surgery. So we see that we can compare the TELOS series with the meta-analysis, and we can say that the TELOS series can be considered that normal for age group, with a LYSHOLM score for 94 points. Where less than 15% patient had knee pain after 2 years, and only 2% have frequent pain. About the complication, we had one case of saphenous nevroma in one case. The other cases was, most of them about algodystrophy, one cyclops syndrome. And I am not sure that it was because of the technique, but maybe not good tibial tunnel. We see that compared to the meta-analysis with ketamine, we are the same or equal with 2 tests more restrictive than the KT-1000, with no laxity, more than 10 millimeters. Most of the patients are less than 6 millimeters laxity differential. Like I said before, 74% of patients recover their level sports practice. And for this series, at the moment when we write it, there were no rupture. So we can say after this short series that we were very satisfactory from subjective and objective perspective for this technique. The post-operative period was generally easy. There were cases of algodystrophy and stiff knees. We are sure that post-op pain control and the follow-up with physiotherapy seems essential for early recognition of any complication. We can say that the short-term results as minimum as good as the other published studies. Of course, other studies will be necessary to confirm these first results. Thank you.